Okay, picture this. You need to get up to speed, fast, on a common medical topic. Maybe you're revising, maybe you just want to understand something important.
Mm-hmm.
You've got the notes, they're thorough, but let's be honest, sometimes dense notes can feel like, well, staring up at a mountain. Where do you even find the absolute highest yield stuff you have to know?
That's the exact challenge we're here to tackle.
Exactly. Welcome to the deep dive. Today, we're taking a stack of notes, like the ones you might use for revision, specifically focused on a condition called a perforated tympanic membrane.
Right.
Our mission is to plunge into these notes, pull out the core knowledge, strip away the fluff, and deliver the absolute must-know facts straight to you.
And we'll be navigating through everything covered in this material. You know, what it is, what causes it, who's more likely to get it, how it actually affects the ear, what else it might be mistaken for, how common it is, the symptoms you'd see, how it's figured out, what happens next, the expected outcome, and any potential problems down the line.
Yeah, it's about making this topic immediately accessible and, memorable for you.
Exactly.
All right, let's unpack this. We're starting with the foundation, the definition. What exactly is a perforated tympanic membrane, according to the material right here?
Okay. At its most basic level, your source material defines it simply as a tear or a hole
Right.
in that very delicate membrane that separates the outer ear from the middle ear.
Okay, a tear or a hole in the eardrum. That makes immediate sense. And what does that hole immediately open the door to based on this definition?
Two main things are highlighted right away.
Hmm.
It can directly lead to hearing loss, and crucially, it significantly increases the risk of getting a middle ear infection, otitis media.
Which, when you think about it, is pretty logical. That eardrum is meant to be a sealed barrier.
A barrier.
A hole compromises that seal. The definition gives us a quick hint at why this might happen, listing things like trauma, infection, pressure changes, loud noise. But let's really dig into the etiology, the causes, as detailed in this next part of the notes.
Right. So this section lays out the primary reasons why that tear or hole forms. The notes list, trauma, middle ear infections,
Okay.
barotrauma, which is damage from pressure changes like, diving or flying.
Oh, okay.
Acoustic trauma from really loud noise, and in some cases, tumors, or even a spontaneous rupture where it just sort of happens without a clear external cause.
That's quite a list of potential culprits. But reading through this, is there one cause that jumps out as the most frequent reason this happens?
Absolutely, and this is a high-yield point from the notes. The material emphasizes that the most common cause of a perforated tympanic membrane is infection.
Infection.
Specifically those middle ear infections we just mentioned.
Infection is number one. That's key to remember. And
Good.
the notes also call out barotrauma and direct trauma as particularly significant contributing factors,
Yeah.
even if infection is the overall leader.
Right. So while infection is the most common driver, sudden pressure changes or like a direct poke or hit are also major players in causing these perforations.
Okay, we know what it is and the main ways it happens. That naturally leads us to who's more likely to find themselves with this condition? What are the risk factors detailed here?
Well, the notes lists several activities and conditions that increase vulnerability. Think about things that involve potential impact or pressure changes around the head.
Right.
They mention sports, especially those that might involve blows to the head or rapid changes in altitude or depth.
Like boxing or maybe competitive swimming or diving.
Potentially, yeah.
Yeah.
The notes also point to something many people do without maybe realizing the risk. Improper ear cleaning.
Ah.
Specifically mentioning the use of cotton swabs. This is a direct trauma risk that's actually very common.
Using cotton swabs feels like such a routine thing. It's easy to forget. It can be, dangerous. What else is listed as increasing risk?
Previous ear surgeries are a factor. Repeated ear infections, which, connects back to the most common cause, and prolonged exposure to loud noises. Then there are those activities, again, involving significant pressure changes. Scuba diving and flying at high altitudes without proper equalization.
So activities that put stress on the eardrum, direct, often accidental trauma like cotton swabs, and a history of ear problems like repeated infections or surgery. Those are the main risk categories outlined. Now let's shift from the what and the who to the how. The pathophysiology section explains the actual mechanism, how this tear leads to the problems we see.
Yeah, this part describes the sequence of events. First, there's the fundamental issue. The disruption of that delicate membrane. It's no longer intact.
That barrier is broken.
Precisely. Step 2, Because the barrier is broken, this creates a direct communication pathway
Okay.
between the external environment, the outside world, the ear canal, and the middle ear space behind the eardrum.
So anything from outside can potentially get into the middle ear now.
Exactly. And this open pathway has two main consequences highlighted. The first is the impact on normal sound wave transmission. The eardrum is supposed to vibrate like a drum head to move sound to the tiny bones in the middle ear. A hole fundamentally changes how it vibrates, or even stops it from vibrating effectively.
And that explains the hearing loss we mentioned earlier. It's a mechanical problem.
Right. The second consequence of that open pathway is the increased risk of infection.
Mm-hmm.
Now that there's a direct route, bacteria or foreign material from the outside can easily enter the middle ear space, significantly increasing the risk of infection.
So the mechanism is clear. Lose the barrier, create a direct connection, disrupt sound vibration causing hearing loss, and open the door to infection. That paints a very clear picture from the notes.
Yeah, it lays it out well.
Before diving into the symptoms someone might experience, the notes wisely bring up differential diagnosis. What else could be presenting with similar symptoms that we need to consider?
Yeah, this is crucial in clinical practice. The notes list several conditions that can mimic the symptoms of a perforated eardrum,
Okay.
meaning you can't diagnose it purely based on symptoms alone. These include simple earwax impaction,
Right, just wax.
infections of the ear canal itself, otitis externa, a middle ear infection, otitis media, which, remember, can cause a perforation but can also exist without one,
Good point.
and middle ear effusion, just fluid built up behind an intact eardrum.
Okay, so ear pain, hearing changes, drainage, those aren't unique to a perforated eardrum. How do the notes say we differentiate?
The notes are very specific. Accurate diagnosis absolutely requires a comprehensive clinical assessment and, most importantly, a thorough ear examination. You have to visualize the eardrum itself. You've got to look.
The exam is the key differentiator here, based on the notes. Moving on, the epidemiology section gives us context about how common this condition is and in which populations we see it most frequently.
A key point here is its common link to middle ear infections, and the notes specifically state this makes it especially common among children.
Ah, that ties it back to the most common cause and a specific age group many people interact with. Kids and ear infections are unfortunately a familiar combination.
Right. The notes also add that the overall incidence in the population is influenced by how common trauma is, how many people have occupational exposure to loud noise, and participation in those high-risk recreational activities like water sports and flying that we discussed under risk factors. These societal or environmental factors play a role in how often it occurs generally.
So think children with ear infections and adults exposed to trauma, loud noise, or pressure changes through work or hobbies. That helps frame the typical patient profile.
Yeah, that's a good summary.
Now let's get specific about what someone with a perforated tympanic membrane might feel or notice. What are the clinical presentations, the signs and symptoms listed in this material?
The notes provide a pretty straightforward list of what you'd look for. A very common initial symptom is ear pain.
That's often the first thing that signals an ear problem, isn't it?
Yes, usually. Then, logically connected to the pathophysiology is hearing loss. The notes describe this as decreased hearing or hearing impairment.
You can see the cause and effect there pretty clearly.
Another important sign is ear drainage, also called otorrhea. This is fluid or discharge coming out of the ear canal.
Okay.
It's a sign that the middle ear contents can escape because, well, the barrier is broken.
So pain, not hearing well, and sometimes fluid leaking out. What else?
The notes also list tinnitus, which is that ringing, buzzing, or other noise in the ear. And in some cases, vertigo or dizziness, the sensation of spinning or losing balance.
Vertigo sounds more significant, maybe hinting at deeper involvement.
It can, yes. And finally, the notes mention that sometimes the sign is simply a visible hole or tear that can be seen during an examination.
So pain, hearing issues, drainage, ringing, maybe dizziness, and sometimes you can literally see the hole when you look. That's the symptom complex to keep in mind, which leads directly to investigations. How do we go about confirming this diagnosis and understanding the extent of the issue based on these notes?
Well, as emphasized earlier in the differential diagnosis, the primary investigation is the ear examination.
Looking in the ear.
Yes. Your notes state this is done using an otoscope or a microscope for that crucial visual inspection of the eardrum. That's step one to see if the hole is there.
The essential physical exam finding. What other tools are mentioned?
To assess the impact on hearing function, audiometry is listed. This is a formal hearing test.
Measuring different frequencies and volumes to see how well someone hears.
Exactly. And the notes list tympanometry as another investigation. This is an examination that evaluates middle ear function
Okay.
by testing how the eardrum moves and responds to pressure changes. It can give clues about the status of the middle ear behind the eardrum.
Okay, so look at it, test the hearing, and test how the middle ear is functioning. Anything more advanced mentioned?
Yes, imaging is sometimes used, specifically a CT scan.
CT.
However, the notes clarify this isn't typically for diagnosing the perforation itself, but rather to assess the extent of any associated issues within the middle ear or surrounding structures, perhaps if complications are suspected.
So, primarily visual inspection, supplemented by hearing and middle ear function tests, and occasionally imaging for more complex situations. Once we have the diagnosis confirmed, what does the management section of these notes tell us about what happens next?
Right, this section contains perhaps the most reassuring and high-yield information for many cases. The primary management approach described is conservative management.
Conservative.
The notes state that often no active treatment is actually needed.
No treatment. That's a relief in many medical situations. Why is that the case?
Because, according to the notes, the tympanic membrane has this remarkable ability to heal spontaneously. It will often close up on its own within, say, 6 to 8 weeks.
Can just repair itself in a couple of months. That's fascinating. So if it's healing on its own, what is the crucial instruction during that time?
The notes are very clear on this key point. Avoid getting water in the ear during the healing period.
Yeah.
This is critical to prevent infection now that the barrier is compromised.
That feels like the absolute most important piece of advice to give someone. Keep water out. What about medication, like antibiotics?
Antibiotics may be prescribed, but according to the notes, this is typically done if the perforation occurred as a result of acute otitis media.
Okay, so if infection caused it.
Exactly. So if an infection caused the hole, you treat the underlying infection. Otherwise, antibiotics aren't automatically given just for the perforation itself.
Got it. Treat the infection if that was the trigger, but the perforation often just needs time and protection from water. Now, what if it doesn't heal naturally within that time frame?
That's when surgical intervention is considered. The notes mention that a procedure called myringoplasty may be recommended if the eardrum doesn't close spontaneously.
Myringoplasty is the surgical repair.
Okay.
So the core plan is wash and wait, protect from water, maybe antibiotics if infection was the cause, and surgery, myringoplasty, if it doesn't heal itself. That covers the key management principles from the notes.
Seems like it, yeah.
What about the prognosis, the expected outcome? How do things usually turn out?
Overall, the notes paint a very positive picture here. The prognosis is generally described as good.
Which ties in nicely with that spontaneous healing capability we just talked about.
Exactly. The notes reiterate that spontaneous healing is common, happening within weeks to months.
Yeah.
They also list factors that can influence how well or how quickly it heals,
Like what?
like the size and location of the tear, whether infections are present during the healing period, and, individual patient factors.
So smaller, clean perforations are more likely to heal well than large, infected ones, which makes intuitive sense. And for most people who get this.
With appropriate management and follow-up, the notes state that most individuals regain their normal hearing.
That's a very reassuring outlook then. Heals itself often, and most people get their hearing back. Good news.
Generally, yes.
But as with any medical condition, there are potential complications. What could go wrong, even with generally good outcomes?
Right. While the outlook is mostly positive, the notes do list potential issues that can arise. These include persistent or chronic ear infections. If the hole doesn't close or keeps getting wet, it can be a pathway for recurrent infections.
So the increased infection risk we saw in the definition can become a long-term problem if things don't resolve.
Yes. Hearing loss is listed again here, not just as an initial symptom, but as a potential long-term issue if the eardrum doesn't heal correctly or if other complications develop.
Okay.
The notes also mention the possibility of middle ear pathology, specifically highlighting cholesteatoma.
Cholesteatoma sounds serious. What does the note say about that?
The notes identify it as a specific potential complication. It's essentially an abnormal skin growth in the middle ear.
Skin growth in the
Yeah.
middle ear.
Yeah. While the notes don't go into extensive detail, identifying it as a complication associated with perforated eardrums is an important point to remember, suggesting it's something to watch out for.
Definitely one to flag as a potential serious issue. What else is listed?
Tympanosclerosis is mentioned. This is the formation of scar tissue on the eardrum during healing.
So it heals, but with scarring, that might affect its vibration or flexibility. Could that impact hearing?
Potentially, yes, though the notes list it as a complication in itself. And finally, the notes mention rare cases of injury to nearby structures.
Nearby structures, like what?
They specifically call out damage to the tiny middle ear bones, the ossicles,
Okay, that makes sense. They're right there.
and even the facial nerve.
Wow. The ossicles, okay, but the facial nerve being at risk in rare cases really shows how incredibly intricate and packed that small area of the head is. It's literally right there.
It really underscores the importance of careful assessment and management. The notes conclude the complications section by stating that regular monitoring and appropriate management are crucial to prevent or address these potential complications.
Which loops back nicely to the need for follow-up, even when the initial perforation might seem straightforward or is expected to heal on its own.
Precisely. Management isn't just about waiting. It's about active monitoring and making sure things are heading in the right direction.
So there we have it, a deep dive into the topic of a perforated tympanic membrane, guided by the notes you've provided. We've gone from the simple definition of a hole in the eardrum to the common causes like infection and trauma, the risk factors that increase vulnerability, the mechanical way it disrupts hearing and invites infection,
Yeah, the pathophysiology.
the other conditions it can look like, emphasizing that vital ear exam, who gets it most often, kids, the symptoms to watch for, pain, hearing loss, drainage.
Tinnitus, vertigo sometimes.
Right, how it's investigated. Look, listen, test middle ear function, how it's managed, often just time and keeping water out, sometimes surgery.
The conservative approach first.
The generally good outlook for healing and hearing recovery, and the potential complications, including those more serious ones like cholesteatoma or even nerve injury.
We've aimed to extract those high-yield points and connect the dots between the different aspects of the condition as laid out in your material, hoping to make this information stick for you.
Hopefully, breaking it down this way transforms those notes from a dense list into a clearer, more memorable picture. And just reflecting on those potential complications. Ponder this. How does a tiny tear in a membrane, something that often heals on its own, remind us of the incredible proximity and interdependence of structures like the ossicles, which translate sound, or even the facial nerve, which controls the very expressions on our face? It really highlights the complex web of anatomy hidden away in that little ear space.
It certainly gives you pause for thought about the body's intricate design and how important that little membrane is.
And remember, this deep dive was powered by the kind of high-yield revision notes that are designed to make learning and retention more efficient.
If you found this approach helpful for tackling complex topics, you might want to explore more resources over at MSRA.com.
And for some fantastic free learning resources, make sure to visit freemsra.com. Keep that curiosity alive and keep diving deeper into the knowledge.
Keep learning. Keep asking questions.
We'll see you on the next deep dive.